everyone. Welcome to The Beat, a news and talk program brought to you by the Center for Community Media here at Worcester State University. I am your host, Maria Kearns-Galeano. Joining us in the studio today is Dr. Matilde Castiel, Commissioner of Health and Human Services. Nice to meet you.
Thank you.
Thank you for being here.
Thank you.
So, you are the Commissioner for Health and Human Services for the City of Worcester. Can you tell us a little more about your role and what you do?
So I oversee the Department of Public Health, the Department of Youth, Veterans, Human Rights and Disability, Elders. Did I say Department of Public Health? I said in the beginning. And then we added homelessness is also part of what I oversee. And what we try to do is sort of work together on some of the same topics that are happening in the community. So that's essentially what I do.
So you're a doctor. Can you tell us a little more about why you became a medical doctor and what your area of study is?
So I became a doctor because I really wanted to help in the community. I think when I first came here from Cuba, I was my parents' interpreter when they were going to the doctor's office, and so I saw what was going on there, and I thought that was interesting, and I wanted to be a part of that. When I was in high school, I started to work in the hospital, and actually I was a pharmacist tech, and then I got to meet people there, and I got to meet a cardiac surgeon who said, you can come and see one of the surgeries. So I ended up going to see the patient beforehand, before he had his surgery, and I got to meet him and thought, got to know him like I say, from the outside. I thought he was a wonderful person, and then the next day I went to see his surgery. So I, knew him from the inside and from the outside, and I thought to me that was fascinating, and so I really wanted to both do that part of really helping in medicine, but also to get to know people in that sense also.
That's awesome. And so, can you explain a little more about your role as Executive Director of the Latin American Health Alliance?
So prior to coming to the city, so I came to the city in 2015. Prior to that, I was a physician in the community. I worked both in Family Health Center, and I worked at UMass Memorial after Family Health Center. And one of the things that I did while I was doing this was part of it was working in the community. My last job was working at Worcester Housing Authority, and I had clinics throughout the Worcester Housing Authority, and I got to really know the community well. And one of the people that I met in the community was Hector Reyes, who was a gentleman, actually one of the first Puerto Ricans who came into Worcester, who he himself suffered with substance use. And one of his dreams and goals was really to get a treatment facility for Latino men. And so I got to learn more about addiction and really work together with him to put a treatment facility for Latino men. So I did that as a volunteer, and we started working on that in 2004. And in 2009, we actually opened the program. And then one of the things we saw when we opened the program was that people also, housing was a huge issue for people. And so in 2011, we opened up a transition house so that people, when they graduated the program, that they could move into a transition house. And then what we noticed when they were in the transition house was that it was difficult to get jobs, and that people didn't have the job skills, partly because a lot of them were incarcerated in the past, and so how do they re-enter back into society? So some of the skills they didn't have. So we worked along with Quinsigamond Community College to get the residents safe serve training and to get them to become prep chef. And so we opened this restaurant, which opened in January of 2015. And the residents rotate through, and it's a Cuban restaurant, just a little touch of me in there. But so it's a wonderful restaurant on Shrewsbury Street that people learn that the residents learn job skills, and then they're able to get other jobs, or they can continue working at the restaurant.
So this restaurant is Café Reyes, right?
Correct.
And the house you're talking about is Hector Reyes.
So
housing?
So the house, the program is called Hector Reyes. The
Okay.
transition house, which were not very original, is called Casa Reyes, and the restaurant is called Café Reyes. So all in honor of Hector Reyes, who this was his dream. Hector Reyes passed away 1 month oh no, actually, we opened, I think we opened in April of 2009. In July of 2009, he passed away.
Wow, so he got to see it.
He got to see it.
That's awesome. So you all have worked to help fight homelessness and addiction in the city. How is the city helping, and what are you doing in the city to help this issue become better?
So in the city, under our city manager, Edward Augustus, we have really implemented a lot of different pieces. One of them is that every police officer and the fire department carry Narcan, and Narcan is the drug that reverses the overdoses. So really trying to prevent, or trying to at least prevent having deaths from the overdoses. So Narcan is, everyone carries Narcan. People in the city have also been trained in Narcan training so that they know how to administer Narcan. Also putting boxes for needles or disposals of needles, because people can, if you find them somewhere, people can get stuck with them, and that's how we get HIV and hepatitis. So putting needles, having medication take back so that you don't keep medications in your house. So one of the ways that kids get it is if your parents, grandparents keep them in the medicine cabinet, kids can go there and get them. So how do we dispose of our medications once we've used them? So those are just some of the things that we've done, and then we've been working in collaboration with other agencies this year, or not this year, in 2015 we worked with AIDS Project Worcester to start needle exchange, so that, and it does two things. One is to get people to give up their used syringes for new ones, but the other piece that it does is also to bring people into contact with somebody that they feel comfortable with, and they can get into treatment. So those are just some of the things that we've done. And then we're working with some of our other partners to look at how we work in the community with regards to homelessness. There is a quality of life team from the city that goes out into the community and really works with people in the community. In particular, there's a lot of encampment, so there's people who are living in tents out in our community. How do we bring them into treatment? How do we help them? And in particular, in the winter, last year we started what was called Hotel Grace, and actually was called by one of the clients, but it was an overflow shelter, so that people who were not accessing this shelter for whatever reason could come into Hotel Grace and and have a place to stay during the cold weather. So those are just some of the things that we've done.
And why do you think this is happening? What are the causes for homelessness and drug addiction? Because surprisingly, lately, we've seen more homeless people in the streets that, I don't know, say 3 years ago. What are some of the causes?
I think a lot of it goes hand in hand. I think mental health is a huge issue, and I think that getting treatment for mental health has become more difficult. And mental health and opioid addiction go hand in hand, and homelessness goes hand in hand. I think that the opioid epidemic, which is a huge public health crisis, has been increasing, and it's been increasing really since 2010, and it still hasn't decreased. And part of it is, how do we get people into treatment, and what other things can we bring? But I think it's part of the whole opioid piece. It has the increased amount of homelessness and the increased amount of mental health. And so our goal is, how do we work with those pieces? How do the hospitals work with the pieces? How does the community work with those pieces? And how does the community overall help us work with the people that are suffering with this illness?
So now that you're talking about community, in one of the talks you made that are online, you talk about technology and the engagement that the community has through technology. Do you think technology helps people get together and helps have people fight for this, or does it distract people from
I think if used in the right way, it certainly helps the community unite. It's a way to bring the focus and the attention and the focus on this issue, so that people understand what is the problem. Otherwise, it's difficult to know what is going on, and how does the community participate in this process is huge. So it has a way of uniting people, and that's, I think, is the biggest part of it.
And besides drug addiction and homelessness, what are other issues in the City of Worcester that need more attention?
So one of the things that the Department of Public Health does is they do a community health assessment, which they call the CHA. And so they actually ask all community members to give us things that they feel are important in the community and that they want to work on. And so from that assessment of what we get from what the community, we put out what's called the Community Health Improvement Plan. And that is a roadmap to the issues in the community. And so what happens is that from that roadmap, every institution in the city, whether nonprofit or for-profit, knows what issues they can work. Our funding is based on the Community Health Improvement Plan. So if you want to work on mental health, you can look at what particular areas of mental health are put forth by the Community Health Improvement Plan. And if you're looking for funding, they want you to collaborate. And so that's part of the piece is that roadmap. And some of the things that are in that roadmap is the most important piece is equity, so that it's health care for all. It's how does everybody access the same system. So equity is an important piece. We look at things like mental health, obesity, exercise. So all of those are issues we look at. I mean, for me, some of the important pieces that I also look at is incarceration, because incarceration is also part of what happened with addiction, because 10 years ago, 10 years and many more years before that, we've been treating addiction with incarceration. And so our jails grew because of that. And if you look at our county jails, for example, 90% of the people that are there are for some crime related to addiction or because of addiction. And so how do we, now that we know, and we've known this, that addiction is a disease, how do we start working with people and treating people? And then when people leave jail, how do we reintegrate them back into society? How do, with their families, how do we work with them to get jobs? Because Corey, they have a Corey once they leave, so how do we get them to have jobs? How do we get housing for them? Otherwise, they will return back to jail. How do we treat addiction overall? I mean, there's different thought processes of how we treat addiction. What's the best method of treating addiction? There's lots of questions regarding whether medically assisted treatment with Suboxone or methadone are helpful. Some people are against it. Some people say that you're treating one drug for another drug. And how do we change the thought process in the community about addiction, and in the sense so that we're all working together to help addiction. I think addiction, homelessness, and mental health are one of the biggest issues that we're working on in the city.
In your experience with these people, do you think addiction can be completely cured? Like a person can completely rehabilitate after being addicted to one of these substances?
I think recovery is definitely possible, and I think you always have to keep track of it. I think it's no different than we talk about obesity and when somebody loses weight, can they gain weight back again? And it's something that you have to work at it. And so it's the same idea. Yes, you can relapse, and you can relapse with many diseases like obesity or diabetes, but how do we not stigmatize that and help people when if and when they do relapse? How do we get them back into treatment and get them back on track? Hopefully people will recover and they won't relapse, but if they do, it's part of the disease process.
That's interesting. So is there anything else you want to tell our viewers?
I think that part of it is the community getting involved and understanding some of the issues. And if there are any questions or any thought process or any ideas that anybody has, please bring them to us. And I'm at City Hall, and they can email me, and I'll be glad to get them and get them involved in issues that they're interested in.
Do you want to give them your email?
What's my email? It's Castiel, CASTIELM, @worcesterma.gov.
Awesome. So thank you very much for watching this segment of The Beat. Please remember to like our Facebook page and follow us on Twitter. We'll see you next time.